Have you ever experienced severe joint pain? Let's say pain in the hands or in the toes. Have you ever woke up and you could not use your hands as they were very swollen and painful? Or you couldn't walk because your feet were swollen? Now you know that is called arthritis. But what kind of arthritis? Are they all the same? In this video, I will explain the signs and symptoms of two of the most common forms of arthritis that people will experience: rheumatoid arthritis and gout. And as a bonus, we will discuss the next steps that you should take to get immediate help. Let's begin.
Rheumatologist OnCall.com.
First, rheumatoid arthritis. Rheumatoid arthritis, also called RA, is the way that we abbreviate it. It's an autoimmune disease that primarily affects the joints. Yes, you heard me right, as rheumatoid arthritis also affects many other organs like the heart, the lungs, the eyes. But the main reason people reach out to me as a rheumatologist is because of pain, swelling, stiffness, especially in the morning, that will last more than 1 hour. As the day goes by, the stiffness will improve. And as you start moving, you can have less stiffness, but the pain may remain. Now let me answer the most common questions about rheumatoid arthritis that I get from my patients and many people from my YouTube community. These questions will help you understand the main differences between rheumatoid arthritis and gout. What causes rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease. What does it mean? When your immune system is turned on by a virus, your lifestyle changes, for example, eating the wrong foods, pollution, or even stress, then it starts overreacting and mistakenly attacks your healthy joints. In time, this ongoing inflammation will lead to joint destruction, deformities, and inability to use your joints. The exact cause that precipitates the immune system is not fully understood. However, researchers show that there are some genes that will predispose people to develop rheumatoid arthritis, but they have to be turned on by certain factors that I just mentioned. Who is at risk to develop rheumatoid arthritis? Rheumatoid arthritis can affect anyone, but it's more common in women and tends to develop between the age of 30 and 60. Unfortunately, there is a notable gender bias, and approximately 70% of people that I diagnose with rheumatoid arthritis are females. Why? Research showed that it might be related to our hormones. Too much estrogen might be the culprit. If you have a first or a second degree relative with rheumatoid arthritis, then your risk of developing this disease is double. If you are a smoker, that will increase the risk as well. What are the most common signs of rheumatoid arthritis? In most patients, rheumatoid arthritis starts in the hands and feet, the small joints of the hands and feet. But there is a specific pattern: the small and big knuckles, sometimes the thumbs and the wrists. You may experience pain, swelling, and stiffness in both hands, both feet at the same time. And this is important because it is not only one joint. There are multiple joints involved. Most patients will have difficulties using their hands in the morning or having problems stepping out of the bed and walking. The morning stiffness, as I said, is prolonged, usually more than 1 hour. And if you want to learn more, watch this video in my channel where I cover the most common 5 signs of rheumatoid arthritis. How is rheumatoid arthritis diagnosed? The diagnosis of rheumatoid arthritis is a combination of clinical signs like joint pain, specialized blood tests such as rheumatoid factor, anti-CCP antibodies, and elevated markers of inflammation like sedimentation rate and C-reactive protein. Some patients might have a positive ANA test. The uric acid is usually normal. Then, in addition to the signs and laboratory tests, X-rays or an MRI might be helpful, especially when these tests are negative. That is why I encourage everyone to get an expert rheumatologist opinion that can diagnose you accurately and monitor this disease. Now, let's shift the gear and understand gout. Here are the most common questions that I receive from my patients. What causes gout? Gout is a metabolic, not an autoimmune disease. What does it mean? It is caused by a buildup of a waste product from our body called uric acid. Uric acid is a normal waste product that often comes from purine metabolism. The purines can come from certain foods or the breakdown of our cells. Eating too many of these foods, like a lot of red meat, beer, lots of sugary drinks, or lots of sweets, or certain diseases like kidney diseases, will cause an increase in the uric acid in the body. This gradual buildup of uric acid will eventually lead to gout. Who is at risk for gout? Unlike rheumatoid arthritis, gout predominantly affects men, but it will affect females at the menopause age. Age is also a risk factor, as very young patients do not usually develop gout. As you age, the risk of developing gout will increase. You will also have an increased risk if you have a family member with gout. Let's say your brother or your father has gout. Then you may develop this disease too. Now, something important. Your diet will increase your risk. If you eat a lot of fried food, shellfish, red meat, processed food, and drink a lot of soda or beer, don't be surprised to develop a gout attack. A long list of medications, like water pills, can also increase the risk for gout. If you want more information, you will find this in all these videos that I posted in my YouTube channel. If you find this information helpful, please give this video a thumbs up and share it with others. What are the signs of gout? Unlike rheumatoid arthritis, gout tends to affect only one joint at a time, like the big toe that is the most commonly affected. If you were at a party the night before, binging on food and some alcohol, and you wake up in the morning with a big, swollen, terribly painful toe, if you could not even stand anything and anyone to touch your joint, then chances are this is a gout attack. Gout may affect other joints like the knees, ankles, wrists, and hands. It can affect one joint and then it can move from one to another joint. If the uric acid builds up for a while, then gout can cause tophi and kidney stones. If you want to learn more about the most common 5 signs of gout, check this video in my channel. How is gout diagnosed? Like rheumatoid arthritis, gout is diagnosed based on signs, symptoms, laboratory tests, and imaging studies. As a rheumatologist, I usually order blood tests like uric acid level and markers of inflammation. Still, I will also check your blood counts and liver and kidney function. X-rays can also be ordered, but they are unreliable as uric acid cannot be seen on X-rays. Other imaging tests like ultrasound or a CT dual energy, which is a particular type of CT, are more reliable for gout diagnosis. Now let's summarize what we have already discussed and understand the critical differences between gout and rheumatoid arthritis and how are they similar. Similarities. Both rheumatoid arthritis and gout affect small and big joints. They cause pain, swelling, and stiffness, and they can eventually destroy joints if they are left untreated. Both cause inflammation that can cause damage to other organs like the heart and the kidneys. Both rheumatoid arthritis and gout are influenced by our genetics and our lifestyle choices. For example, obesity can cause worsening of both of these diseases, as it will increase inflammation. Processed food and too much sugar will also increase inflammation and the risk of developing rheumatoid arthritis and gout. Differences. Rheumatoid arthritis is an autoimmune disease, whereas gout is not. Gout is caused by the buildup of uric acid in your body. Usually, rheumatoid arthritis affects hands and feet mostly at the same time in a symmetric pattern with multiple joints involved, while gout often starts in one joint, like the big toe, and then may involve other joints, like the knees, ankles, or hands. Gout attacks are acute, meaning you wake up in the pain the next day, which may decrease or go away in a few days or 1 week. However, rheumatoid arthritis can cause pain that lasts for weeks or months, or even worsen with time. I hope the answers to these questions will help you better understand two of the most common diseases in my practice, Rheumatologist OnCall. And now, as I promise you, the bonus question. How to find help for rheumatoid arthritis or gout when you need it the most? As you probably experience, being in pain due to rheumatoid arthritis or gout is not fun. It can be extremely disabling. It may stop you from doing work or going to work, participating in the hobbies that you like, or even miss important events in your life. Most of you who have experienced gout or rheumatoid arthritis know exactly what I'm talking about. If you have a gout attack, you will most likely be forced to go to the emergency room, as many times your primary care physician will not be able to see you for many weeks. That will add much to your stress, and let's face it, it will be much more expensive. A visit to the emergency room will likely generate a bill of at least a few $1,000s, if not even more. Or, if you have joint pain and your primary care physician suspects rheumatoid arthritis, then he or she will refer you to a specialist, a rheumatologist. First, you will have a big hurdle. Many rheumatologists do not take your insurance. Many rheumatologists do not accept new patients. Or it will take you many months, usually 3 to 6 months, until you will be seen. And in the meantime, what are you going to do? Stay in pain? Eat ibuprofen like candies? This is something that I consider unacceptable. This is why I started my company, Rheumatologist OnCall, to help people like you, people that are in pain now, when they need it the most. My company is able to see patients in multiple US states. We are also able to see patients worldwide that will need our help to sort out a diagnosis. We help people from the comfort of their homes. No need to travel or wait in a waiting room for many hours. But not only that, but we do not discriminate based on your insurance. We do not delay your care, and we offer you truly affordable pricing and transparency of all costs. We are here to help people when they need it the most, not in 6 months. Now, if you need our help, do not hesitate to contact us. If you know someone struggling to see a rheumatologist, or someone that needs a rheumatologist that will take excellent care of them, check out our website and schedule an appointment. Thank you for joining me today. If you have any comments, please leave them at the bottom of this video. I will try to answer them as much as I can. Thank you for watching. See you next time.
Rheumatologistoncall.com